I don't know if you've seen that video up there where the learned gentleman is talking about keeping old clothes and empty boxes as a sign of a disorder. And I've had a couple of tags as well asking how true this is. But let's talk about the clinical reality. When does collecting or keeping old clothes become a hoarding disorder? In psychology, hoarding isn't just about having too much stuff. It is a persistent difficulty of letting items or things you have go because you perceive you need to save them. This leads to clutter that actually makes living spaces unusable. So, when do we diagnose an individual with hoarding disorder? We look for three main signs. 1. Excessive buying or acquisition. That is when you buy or bring more items than you can manage into your living space. 2. You have difficulty discarding things you don't need. That is feeling an intense distress of the thought of throwing something away. 3. Functional impairment. When you can no longer use your kitchen to cook or sleep on your bed because that is where you've kept the items you are hoarding. Hoarding disorder is often about emotional attachment or a fear of losing a memory. For many people, these items feel like a part of their identity. So these people are not just lazy or just love to keep items. This is a way to cope with anxiety or past trauma. So yes, keeping old clothes and empty boxes can sometimes be a sign of a disorder. However, this disorder is very treatable. All you need to do is to seek help from a psychologist. If this is your first time coming across my page, hi, I am Miss Aban, and I'm a licensed psychologist. Follow for more mental health education.